More and more patients are choosing implants as a way to replace missing dentition. Success or failure of implants depends on osseointegration. Dr. Sowinska, owner of ABM Dental Office, will explain this and other factors influencing health of the newly implanted teeth. So, what is osseointegration?
Yes, thank you for having me here. Osseointegration is like a self-describing term from the Latin. Osseo means bone and integrare means put together. So it describes the structural and functional growing bone and implant together.
What are risk factors for failing dental implants?
We're starting with failing, but of course, you know, like this is a gold standard in dentistry that we are replacing missing teeth with implants, and I highly recommend this over the other treatments, like for example prosthesis or bridges. But yes, we have to consider while choosing implants what are the pros and cons of implantology. So we have to consider the sex of the patient, age of the patient, oral habits, oral hygiene of the patient, systemic health, because it has great influence over the success or failure of the implant. We also have the habits like smoking, and the researchers in University at Buffalo discovered that failure of the implants of the patients who are smoking is 11% comparing to the non-smokers, which is 5%. So we see that the implant failure overall is not big, it's 5%. But there are some factors which are influencing and we are making the failure bigger. For example, systemic diseases like oral diabetes, which can have 40% of failure when the sugar is not stabilized.
So why this disease on diabetes can cause implant failure?
Diabetes mellitus, the high sugar in the blood, hyperglycemia otherwise, it has like dual interference with, or of course we're only talking about the implant failure, not about other organs which are also highly affected by the diabetes. But it has a dual action. The first one is it has influence of a parathyroid hormone, which in way is influencing the metabolism of phosphorus and calcium, and both minerals are influencing the growth of the matrix, bone matrix, the adherence of the cells to the implant body, the intracellular and extracellular matrix components. So we have good news. Using insulin will help, and when the patient has stabilized blood sugar, of course the success of the implant is great. But stabilizing the sugar causes implant failure.
Last time we talked about Tscan occlusal analysis. How it can help to prolong implants' life in the mouth?
It does have great influence, because we have, of course, we have function, not only integration, bone integration is important, but also how the implant functions in the mouth. And when we have the premature contacts, when we have the forces which are over the limit and critical limit which can implant sustain, the powers are too great, of course the implant will fail, because our body does recognize these forces and changes the tissue. So instead of osseointegrations, we have actually fibrotic encapsulation. So instead of bone, the fibrotic tissue grows, and then implant starts to wobble and falls out of the mouth.
What about other diseases like cancer patients?
cancer patients, this is a good question. So ongoing cancer treatment is a no-no for the implantation, but after chemotherapy and successful irradiation of the bone, we can treat the bone with hyperbaric oxygen before the implantation, and then the success rate goes up, because the failure is about 30%. So it's still good, you know, like 70% success is good, but we postpone the treatment before we treat the irradiated bone with oxygen under the pressure, and then we implant, and the success rates are much better.
Many people are on medication. Can medication be a reason for implant to fail?
Yes, and again, University of Buffalo researchers noticed that a compound which is in prescribed antidepressants can change the structure and the healing of the bone matrix, so the osteointegration is slower. Also corticosteroids, especially systemic therapy on someone who is on corticosteroids for some diseases, can notice that the tissue is more fragile, epithelium is more fragile, the bone doesn't heal so well, and other tissues don't heal so well. So corticosteroids are the next medication. And of course, you know, like we have patients with cancer who are having the immunosuppressants, they also have influence. Another group of patients who we have to consider, those are recipients of liver transplant, renal transplants, or heart transplants. They are put on for life on the immunosuppressants concomitant with the corticosteroids. So there is like kind of double influence, and we notice that cyclosporin A and corticosteroids have negative influence on the healing and on the bone integration.
I think we already talked about it, but what about smoking, drinking alcohol? These things?
Well, a lot of us are smoking, and I usually recommend that if someone is smoking, so at least cease the smoking for the period of osteointegration before the bone is matured. Someone should not smoke, and I'm thinking that if someone is already deciding not to smoke for 6 months, well, maybe should not smoke at all. Also, alcohol has influence, and the researchers found that nicotine in tobacco is directly influencing osteoblasts, which are bone-bearing cells, and they are not transferring to osteocytes, which are the bone cells. So this is interfering, so maturity of the bone is not so well, the healing is not slower, it's not so great. So yeah, smoking is a no-no. Unfortunately.
Well, why unfortunately? I think it's well, a good reason not to smoke.
That's true.
Is there any age limit for having an implant? How old can be patient to have implants?
Well, the age factor is a great prognostic tool for us, but you know, like the spectrum is from very old people to very young people. With older patients, we have problem because sometimes the bone, the tooth was lost long time ago, so the bone is also shrinking, and it's the healing processes are slower than the younger people, but also a lot of older patients have systemic diseases. The different problem is with younger generation, because we have different growth spurts for the different sexes. Boys are growing slower, they are maturing between 11 and 17, and the girls are starting between 9 and 16. So we have like about 6 years of difference, so we really have to treat young patients very individually, considering the implant placement. But I think that if someone would ask, the safe age is after 21 years of age. Because we have a specific phenomenon in dentistry. Actually, we have what it's called the spontaneous downward drifting of teeth. So it is mesial drift, so it's forward, and it's about 5-6 millimeters for both sides, so it's quite big. And if you think about this implant has the static relation with the bone, so it doesn't move. Thanks God doesn't move, because we don't want the implant to move. But it doesn't move, it doesn't grow with the person, and this growth is between 10 and 21 years of age for the lateral segment, so it's between molars and the canines. For the frontal segment, also its movement is not so great, it's 2.5 millimeters on average, but if we insert the implant prematurely when the patient is still growing and still this mesial drift is occurring, the front tooth, the implant will stay behind because the front teeth will move forward. So this is why we have to really consider the age as a factor.
What is perimplantitis?
Perimplantitis, it's an inflammation of the tissues surrounding the implant, so it's the soft tissues and the bone. And someone may ask, like, what to look for if my implant is failing. First, some patients have pain, but some of them are not having pain. So if the implant starts to wobble, if it shifts a little bit, if it moves a little bit, this is a first like kind of stop sign, something is happening with the implant. But also suppuration can occur, so we have like pus coming, so it's purulative suppuration, or blood. So when patient comes for the visit in the dental office, the hygienist will do, as always, the measurement of the pockets, and the pockets are deeper because implant is losing the bone. The soft tissue might be mimicking that there is still nice height, but on the X-ray, when we do the X-ray, we see that the bone is lost. So it's very important actually, and I recommend to, of course, keep the meticulous hygiene at home, but also depending on how many implants, depending on different factors, as I said, systemic factors. So each patient has individual schedule, but mostly 4 months for the patients who have implants is a good idea to have an appointment with a hygienist.
How important then is the oral hygiene?
Oh, it's very important. Both hygiene at home and hygiene when someone comes to the dental office. We have different bacteria in our mouth, and the flora, microflora, which is in perimplantitis, is very specific to the site. So we have cocci, and we have also non-motile rods, and we are very happy to offer our patients also Tscan is the first one, but second, for the inflammation, we have laser debridement. So we're using the diode laser called Navigator to clean the area around the implant and cause like a sterile wound. And the sterile wound, it's promoting the osteoblasts and fibroblasts to grow back to the implant. Also, we are having the longer systemic when we see that like there is inflammation around the implants, but also around the teeth. We can put someone on the long, like 1 year long systemic therapy with low doses of antibiotics, which are changing the microflora, we are changing what kind of bacteria, there will be more friendly bacteria in our mouth, so it stabilizes the situation. So also I would like to tell that with oral hygiene at home, regular toothbrush is working, but we also recommend the micro brushes. I call them Christmas brushes. Those are called sulca brushes. They go into sulcus 3 millimeters down the sulcus, so they clean really nicely the neck of the implant. And also I recommend the water pick, which is wrongly named misnomer. It is a misnomer that it's water flosser, because we have to mechanically clean the interdental areas, so we have to use regular floss, but water pick flushes really nicely the remnants of the bacteria or remnants of the food which was not removed by the floss from the spaces between the teeth. So Altogether, I invite everyone to have a Tscan done when the implant was placed in the mouth. If someone has problems, we have, as I said, we have couple modalities to treat the implants when they are starting to fail and stop the process, so the implant will stay in the mouth. And of course, I'm inviting everyone to our dental office, which is located at 4240 Wilcox Road in Mississauga, very close to St. Maximilian Kolbe Church parking. Our phone is 905-272-9966. Our friendly receptionist will book an appointment for anyone who wants to have an appointment with us.
Dr. Sawinska, thank you very much.
Thank you so much for having me. Thank you.